Prostate cancer is one of the most common cancers affecting men worldwide. Despite its prevalence, early detection can make a significant difference in treatment outcomes and overall prognosis. For many men, understanding the early warning signs is the first step toward timely intervention and better health. While not every symptom automatically means you have prostate cancer, being aware and proactive can lead to early diagnosis and more effective treatment. In this segment, we'll explore 10 early warning signs of prostate cancer that every man should know. The first warning sign to be aware of is frequent urination, particularly during the night. If you find yourself waking up repeatedly to use the bathroom or needing to urinate more often than usual during the day, it could be a sign that something isn't quite right. The prostate gland surrounds the urethra, so when it becomes enlarged due to cancer or other conditions, it can press on the urinary tract and disrupt normal flow. While other factors such as age or benign prostatic hyperplasia, BPH, can cause similar symptoms, persistent changes in urination patterns should never be ignored. Another early sign is difficulty starting or stopping urination. You might notice hesitancy when trying to begin urinating or experience a weak or interrupted stream. Sometimes, you may feel that your bladder isn't completely empty after urinating. These issues often result from the prostate pressing on the urethra, making it harder for urine to pass through. If these symptoms persist, it's important to consult your healthcare provider as they could signal underlying prostate issues, including cancer. Next, pay attention to pain or burning during urination. While urinary tract infections can also cause these symptoms, persistent discomfort or a burning sensation can be a warning sign of prostate cancer. The inflammation caused by cancerous cells in the prostate may irritate the urethra and surrounding tissues, leading to pain. If this symptom continues for more than a few days, it's worth seeking medical advice to rule out serious conditions. Blood in urine or semen is another critical warning sign. If you notice a pink or reddish tint in your urine or semen, even just once, do not ignore it. Blood can indicate that cancerous cells have invaded nearby tissues or blood vessels. Though bleeding can result from other causes like infections or kidney stones, any occurrence should be promptly evaluated by a doctor to determine its origin and rule out malignancy. Unexplained pain in the lower back, hips, or pelvis can also be an early sign of prostate cancer. The prostate is located just below the bladder and in front of the rectum, and cancer can spread to nearby bones and tissues. Persistent aches or discomfort in these regions, especially if not linked to physical exertion or injury, should be taken seriously. As cancer advances, bone pain can worsen, so early detection is crucial. Another possible warning sign is painful ejaculation. If you consistently experience discomfort or pain during or after ejaculation, this could be a symptom of prostate cancer. The prostate plays a key role in producing seminal fluid, and when affected by cancer, it can cause inflammation and pain. While other conditions, such as prostatitis, may cause similar issues, it's essential to get checked if this symptom persists. Erectile dysfunction, especially if it develops suddenly and without an obvious cause, can be a subtle sign of prostate cancer. The nerves and blood vessels involved in achieving and maintaining an erection pass close to the prostate gland. As cancer develops, it can interfere with these pathways, leading to problems with sexual function. While there are many potential causes of erectile dysfunction, a new or worsening problem should prompt a discussion with your healthcare provider. A weak or interrupted urine flow is another sign to watch for. If you notice that your urine stream has become less forceful or tends to stop and start unexpectedly, it may be due to an enlarged prostate obstructing the urethra. While not always indicative of cancer, it warrants investigation, especially if accompanied by other symptoms. Difficulty controlling the bladder, such as experiencing sudden urges to urinate or even episodes of incontinence, can also be an early warning sign. The pressure from a growing prostate tumor can affect the muscles and nerves responsible for bladder control. If you've begun to notice increased urgency or leakage, particularly if these issues are new for you, don't hesitate to seek medical advice. Finally, Unexplained weight loss or fatigue may signal advanced prostate cancer. While these symptoms are more commonly associated with later stages, some men experience them earlier in the disease process. Cancer can cause systemic changes that sap your energy and lead to weight loss, even if you haven't altered your diet or exercise routine. If you're feeling unusually tired or losing weight without trying, it's important to speak with your doctor. Recognizing these 10 early warning signs can empower men to take charge of their health. Frequent urination, difficulty starting or stopping urination, pain or burning during urination, blood in urine or semen, unexplained pain in the lower back, hips or pelvis, painful ejaculation, erectile dysfunction, weak or interrupted urine flow, difficulty controlling the bladder, and unexplained weight loss or fatigue are all symptoms that should never be ignored. While some of these signs can be caused by less serious conditions, they are still important indicators that should prompt further evaluation. If you notice any combination of these symptoms, don't wait for them to go away on their own. Early detection is key to successful treatment, and most men diagnosed with prostate cancer at an early stage have excellent outcomes. Regular checkups, including prostate-specific antigen, PSA tests, and digital rectal exams, are valuable tools for monitoring prostate health, especially for men over the age of 50 or those with a family history of prostate cancer. It's important to remember that having one or more of these symptoms does not mean you have prostate cancer. Many other conditions, such as infections, benign prostatic hyperplasia, or even lifestyle factors, can cause similar issues. However, awareness and timely action are your best defenses. If you're experiencing any of these symptoms, schedule an appointment with your healthcare provider for a thorough evaluation. Beyond symptom awareness, maintaining a healthy lifestyle can also support prostate health. Eating a balanced diet rich in fruits, vegetables, and healthy fats, staying physically active, and avoiding smoking and excessive alcohol consumption can reduce your risk of developing prostate cancer and improve your overall well-being. In summary, prostate cancer is a serious condition, but it is highly treatable when caught early. By keeping these 10 warning signs in mind and acting promptly if they arise, you can play a proactive role in safeguarding your health. Stay informed, listen to your body, and don't hesitate to seek medical advice if you notice changes. Your health is worth it.